Okay, so tonight's topic is glutathione, the visionary antioxidant. I will spend a lot of time go through the eye diseases. By now, you all are experts on what is glutathione, and then in the end, I tie up with what glutathione can do with the eye diseases. Okay, oops. All right, so the eyes, we all take this pair of organs that we have, we take it for granted. Uh, Without it, we cannot appreciate the world without us, and therefore we should be thankful to God for this pair of eyes. Same time, we should take care of our eyes so that they remain healthy. Because as we all grow older, the eyes are going to start having problems, as many older people have come to realize. Um, my batchmates this year we are celebrating the 70th year. Many have gone for the cataract operations. So eye problems or diseases can start in childhood, although they are more common in the older people. Okay, so that you can understand what when I'm referring to the parts of the eye. So this is there's a revision on the anatomy of the eye. So if you look externally, then you have the eyelids, the upper and lower eyelids, and then you have the pupil, the iris, and the sclera. The sclera is the white of the eye. The iris is the colored part of the eye. The pupil is the dark part of the eye where the light goes through. If you look at the cross section, and this is a cross section cut horizontally. Cut horizontally. That means it's viewed from above. The right eye be viewed from above. So you have the cornea in front, then so the light, but here I stress that where the light can go through, the harmful UV rays also can go through. Okay, so the same path. Yeah, they're talking about the light going through, but with the light comes the harmful ultraviolet rays. So it hit the cornea, and then it hit the lens, and then we pass into the cavity of the eye, but it's not empty. Yeah, it's filled with a fluid called the vitreous humor. Whereas the anterior chamber in front of the eyes is filled with the aqueous humor. Aqueous humor means it's not as thick as the vitreous humor inside. And then the back wall of the eye is the retina with all the light sensitive nerve endings, and then where the light is focused to form an image is the macula, and then you also have the nerves and the blood vessels coming together at the optic nerve, and which also surrounds the retinal blood vessels. So that's the rough anatomy of the eye. Okay, so what eye problems do we get in children? Rarely a child may be born blind in one or both eyes. Such babies will not respond normally to the mothers and others. Early vision screening is essential as soon as any visual defect is suspected in babies, so that early treatment can be given if available. Blindness can also happen at any time due to trauma or serious eye infections. About 20% of babies are born with blocked tear ducts, which can cause the eyes to become watery and easily infected. Fortunately, a simple massage technique can solve this problem. Then you have the lazy eye, amblyopia, happens when one eye does not develop normally, and children can get amblyopia when they do not get treated for problems like refractive errors, strabismus, droopy eyelids, or cataracts. And strabismus, crossed or misaligned eyes, is due to weakness of one or more eye muscles. It is quite common in children, 1 in 25, that is 4%. Yeah? It affects vision and must be treated early. Occasionally, strabismus develops later in life as a complication of certain chronic diseases or trauma. So that's the lazy eye on the left compared to the normal, healthy eye on the right. And then on the misaligned cross-eyed, then you have the eyes, the abnormal eye may be pointing downward, maybe pointing outwards, maybe pointing upwards, or maybe pointing inwards. Yes, some children are born with droopy eyelids or ptosis. If it is severe, it may interfere with the vision of the affected eye and should be treated. Otherwise, it may be allowed to improve over time. A child with cataract, right? Children also can get cataract, usually from trauma. Or retinoblastoma, which is a rare childhood cancer of the retina, may be first suspected because of the appearance of a cloudy eye. So this is a child ptosis, droopy eyelid of the left eye. This is with cataract. Okay. Then children also get conjunctivitis. So adults who can get conjunctivitis. This is the inflammation of the white part of the eye. It is caused by infection, can be viral or bacterial, and both are very contagious. I'm sure every one of us has had the experience of having conjunctivitis. Conjunctivitis can also be allergic, all right, due to allergy, and which is not contagious. The eyes may be red, itchy, and teary, or have a sticky discharge. An appropriate eye drop or eye ointment may help hasten recovery, depending on the cause, right? Antibiotic if due to bacteria. It usually lasts less than a week, but it spreads very fast if it's infection. Other common eye problems include styes and chalazions. Styes are inflamed or pustular lumps at the edge of the eyelid. These are usually treated with antibiotic ointments, while the chalazions are lumps on the eyelid caused by blocked oil glands. Most resolve spontaneously. Okay, of course, you have eye infections, right? This is very bad conjunctivitis. Okay, and you can have viral, bacterial, or allergic conjunctivitis. And then you have stye and chalazion. Okay, chalazion is on the upper eyelid, whereas the stye can be both upper or lower. Of course, refractive errors are very common, with children and young adults tending to have short-sightedness, while older people tend to have far-sightedness. And these are easily corrected by spectacles and contact lenses, and some are corrected by laser treatment. Conjunctivitis and blepharitis are also common in adults. Blepharitis is the infection of the eyelid. Okay, so you have problems of short-sightedness or nearsightedness and far-sightedness, and you have problem of conjunctivitis we see earlier on, and this is blepharitis, right? The eyelids are infected. Now we move on to the older adults. In the older person, cataracts and glaucoma become common and many require surgical treatment. Glaucoma and cataracts are two common chronic eye diseases, but they affect your eyes very differently. You can, however, have both cataracts and glaucoma. So they are actually different diseases, but externally, sometimes difficult to tell the difference. Cataracts may occur naturally with glaucoma, may affect your glaucoma, or may even occur as a result of having had glaucoma surgery. Okay, so they are common, and they can also occur simultaneously. So cataracts are eye lenses which are cloudy due to the breakdown of the proteins in the lenses. This happens as part of the aging process, but there are also other causes of cataracts. For example, in children, then there's trauma, right? And vision will become blurry and hazy. So if you have cataract, then your lens become cloudy, then the light is not focused sharply to the back of the retina. Instead, it is scattered or even totally blocked. If totally blocked, then you see nothing, it's all black. If it's scattered, then everything becomes blurry. Fortunately, the treatment for cataract is simple. It's just a surgical removal of the affected lens and then replacing with a lens implant. What about glaucoma? This happens when there is increased pressure in the fluid which fills the eye chamber. If untreated, it will cause damage to the optic nerve and impair vision permanently. Okay, so the fluid, as mentioned in the eye chambers, not only they circulate and is continually being replaced, but in the case of glaucoma, there is a blockage right in the system for the outlet of the flow of the aqueous humor, the fluid that fills up the anterior chamber. So there'll be backflow and there'll be pressure built up. There'll be pressure built up in the posterior chamber. And this pressure will gradually impinge on the optic nerve, causing damage to the optic nerve and, of course, to the vision. Chronic diseases can lead to eye problems. Example, diabetic retinopathy, while the elderly may get poor vision or even central blindness due to AMD, which is age-related macular degeneration. Okay, we're all very familiar with diabetic retinopathy. We've often spoken about diabetes, and one of the complications of diabetes is diabetic retinopathy. Okay, so you compare the normal eye with the diabetic retinopathy, where you have hemorrhages, newly formed blood vessels, and then you have microaneurysms. Okay, and this is what the doctor sees when we do fundoscopy. So in the normal retina, that's what you see. And then on the left side, a non-proliferative diabetic retinopathy, where the blood vessels are there, but they're all abnormal, with the bleeding, with exudates, and with aneurysms. What noise is that? Okay, but in the proliferative form, which is worse, there are abnormal blood vessels being formed. Not only the blood vessels are engorged as in the non-proliferative diabetic retinopathy, now new blood vessels are formed in an abnormal pattern, making things worse. So anyone who has diabetes can develop diabetic retinopathy, but the risk increases with these factors, right? The duration of diabetes. So usually it takes time for diabetic retinopathy to develop, but it'll be faster if you have poor control of the diabetes. Then you are at higher risk if at the same time as diabetes, you also have high blood pressure, high cholesterol, you smoke, and you're pregnant. And in US, the differences between the white population and the non-white, right? The African American, Hispanic, or Native American are at higher risk of diabetic retinopathy. Everything has been equal compared to the Caucasian. So what are the complications from diabetic retinopathy? So this condition can lead to serious visions. So earlier on, we talked about glaucoma. So with diabetic retinopathy, then you can develop glaucoma because of diabetic retinopathy. Already, diabetic retinopathy itself is a major problem. So as new blood vessels associated with diabetic retinopathy grow, the pressure in the eyes can build up, a condition known as glaucoma, as explained earlier on. Excess pressure in the eye can damage the optic nerve, resulting in further vision loss. And then you can have retinal detachment. Diabetic retinopathy is associated with abnormal blood vessels growth in the eyes. This abnormal growth can create scar tissues which can pull the retina away from the back of the eye. And then you have vitreous hemorrhage, right? That is hemorrhage into the fluid liquid content of the posterior chamber. Diabetic retinopathy can cause the new blood vessels to bleed into the clear, jelly-like substance that fills the center of the eye. If too much blood leaks, it can fill the vitreous cavity, resulting in blocked vision. And finally, of course, you can become blind diabetic retinopathy can eventually lead to complete vision loss. So diabetics, you must have regular eye checks with the ophthalmologist. Okay, finally we come to AMD, the age-related macular degeneration. This disease affects the central vision and can result in severe loss of central vision, but rarely go totally blind, as opposed to diabetic retinopathy and a few other conditions. And this is mainly due to damage by free radicals to the macular part of the retina. What are the risk factors for AMD? Diet high in saturated fat, obesity, smoking, family history of AMD, age 50 years old or over, of course, every year increases the risk. If you are into your 80s and 90s, you'll be lucky not to have any degree of AMD. And then Caucasian compared to blacks in the US, if you have high blood pressure, heart disease, and high cholesterol, you are at higher risk of AMD. So when you compare the normal and the retina with the macular degeneration, so you can see the difference. There is atrophy at the macular region, so that's why you have central loss of vision. Then you have subretinal hemorrhage, that means hemorrhage bleeding behind the retina. And you have protein deposits called drusen. So the dry form of AMD, this form is quite common. About 80% of people who have AMD have the dry form. And this is when parts of the macula get thinner with age and tiny clumps of protein called drusen grow. People with dry AMD may have drusen, pigment abnormalities, or geographic atrophy. That means the areas of cell loss in the retina, and you slowly lose central vision. So you compare, you have almost like dry and wet AMD as compared to the two types of diabetic retinopathy mentioned earlier on. In wet AMD, this form is less common but more serious. Wet AMD is when new abnormal vessels grow under the retina. So the same thing in diabetic retinopathy. The worst version is when there are new abnormal blood vessels growing under the retina. These vessels may leak blood of other fluids, causing scarring of the macula. You lose vision faster with wet AMD than with dry AMD. So this is the kind of vision you can expect to have if you are fortunate enough to develop this condition. See the vision, see the retina in the normal eye, the fundoscopy, and the clear vision of normal eye compared to the dry macular degeneration. So you have unusually fuzzy or distorted vision, and the wet form of macular degeneration, where there's almost a circular blot, blackish dark disturbance in your vision because of the defective macular area in the retina. Okay, so this is the Amsler grid that can help us monitor our vision as far as macular degeneration goes. So let's have some fun. Okay, here's how to use the Amsler grid. Keep the Amsler grid in a place where you see it every day. Many people keep an Amsler grid on their fridge door or on their bathroom mirror. In good light, look at the grid from about 12 to 15 inches away. Be sure to wear your reading glasses if you normally use them. Cover one eye, look directly at the dot in the center of the grid with your uncovered eye. Notice if any of the lines look bent or wavy. See if any part of the grid looks blurry, dim, or out of shape. Now cover your other eye and test the vision this way again. call your ophthalmologist right away if you notice that any lines or parts of the grid look wavy, blurry, or dim. Okay, look, sorry. Okay, so look at that, close one eye, look at the center of the dot, and see whether you should call the ophthalmologist immediately or not. When you're done, okay, do with the other eye. Okay. Uh, this could be, what somebody with very bad macular vision, see a distortion in the lines. Okay, what about glutathione and the eyes? So from the available research, we know that glutathione protects the eyes from blindness, glaucoma, cataracts, diabetic retinopathy, AMD, and many more. And how it does this is glutathione protects against the free radicals to which the eyes are directly exposed, and sun rays penetrate the cornea into the inner structures, causing damage and degeneration. And it is glutathione which is that is the main protector of the different parts of the eyes and, of course, the eye overall. Now, let's go into detail. Okay, glutathione and cataracts. Glutathione exists in an unusually high concentration in the lens, where it functions as an essential antioxidant vital for the maintenance of the lens transparency. Okay, take note. It is glutathione that maintains the transparency of your lens. So those people that end up with cataracts over long term, that means too long, you didn't have enough glutathione. Glutathione levels are significantly lower in lenses with cataracts compared to healthy lenses. In addition, the researchers found that glutathione levels were even lower in nuclear cataract lenses compared to cortical cataract lenses. Okay, because cataracts can happen either in the center or in the periphery of the lens. So the nuclear is where the cataract is in the center. The cortical is where the cataract is in the periphery. Glutathione and vitamin C work together to promote water balance within the lens and prevent the protein clumping that can lead to cataracts. Okay, so apart from, we know both of these are antioxidants, so they work together as antioxidants, and they also work together to maintain proper water balance of the lens. There is even a link between childhood cataract and glutathione depletion in the mother, all right, in maternal malnutrition. You see, that's how important glutathione is. If the mothers have glutathione depletion, then the children, the babies born, are at risk of childhood cataract. What about glutathione and glaucoma? Some studies suggest that levels of glutathione may be low in people with glaucoma. Abnormal glutathione function within the retina may play an important role in glaucoma. Although the function of glutathione in the retina is not fully understood, there is some evidence that it may have a role in neuroprotection under harmful conditions such as ischemia and oxidative damage. And multiple studies have shown an association between the presence of GSDM1 and glaucoma. What is GSDM1? GSDM1 is a defective variation a variant of glutathione S transferase. That is one of the enzymes in the glutathione system, and glutathione S transferase, or GST, is involved in glutathione's work with protein. Okay, glutathione is the substrate. Okay, and GST-M1 does not fight oxidative stress as effectively as the other variant. So when they have GST-M1, then they will require a lot more of glutathione to have the same effect in fighting oxidative stress. Okay, this is what they found in those with glaucoma. They have this defect in the glutathione system. So you can see again, right? Glutathione is involved. with cataracts, with glaucoma. What about AMD? I will skip diabetic retinopathy, because with diabetic retinopathy and with all the complications of diabetes, we have discussed many times the importance of glutathione in fighting the oxidative stress that leads to all these complications. So in AMD, low levels of glutathione are also observed in macular degeneration patients. Early AMD patients have high levels of oxidized glutathione, a biomarker for AMD. Okay, so glutathione helps protect the retina from oxidative damage. So remember, glutathione exists in the reduced form, GSH, and the oxidized form, GSSG. So early AMD patients have high levels of GSSG. Research into the pathogenesis of macular degeneration finds that depletion of glutathione contributes to premature cell dysfunction, that is stress-induced premature senescence, or SIPS, iron-induced cell death, or ferroptosis, and the body's removal of damaged cells and autophagy. Okay, so glutathione is involved in all all this, right? Fighting cellular stress, regulating apoptosis and ferroptosis. Ferroptosis is apoptosis, controlled cell death. Ferroptosis is controlled cell death that involves iron. Okay, and autophagy is the recycling of cell parts of damage and old cell parts to prevent further damage to the cells and to prevent cancer. All require glutathione. So there is depletion of glutathione in the retina, and in particular the macular part, then you have thinning of the retina there, and loss of function of the macular cells, and therefore you lose your vision. Okay, so that summarizes in more detail how glutathione is involved in 4 of the major eye problems that we may face as we age, that are cataracts, glaucoma, AMD, and for the diabetic retinopathy. Okay, so I will not go to the usual story about what happens as we age, blah, 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 blah. I think you all are experts by now. So thank you very much. Over to you.